All right, so we're going to be starting chapter 8. It's broken down into two parts, chapter part A and a part B. If you have any questions, please email me or send me a message through YouTube. In addition, you can also leave them in the comments below. If you like it, please give this video a thumbs up. Please be sure to subscribe. As soon as the new videos are up, you guys will get immediate notification. And also, if there's any other material that you'd like, please let me know that as well. So, beginning with chapter 8, this chapter is on joints. Now, a joint, or also known as articulations, are points where you have two or more bones that come together. Okay, so whenever you have two or more bones that are meeting, we say that they're articulating. So that's an articulation point. So joints, they connect two bones together. Right, they're points where two bones meet. In addition to that, joints, they also provide mobility. Between the two bones as well, or they may be able to provide mobility if it's a movable joint. As you're going to learn in this chapter, some joints there's absolutely no motion at all. Other joints there's a wide degree of motion that they provide. Now, although joints are the weakest part of the skeleton, their structures they resist various forces such as crushing or tearing that threaten to misalign them. Now, joints, they're classified by structure and function. Now, when we're talking about structure, we're talking about what materials are present that binds the joints together. In addition to that, we're also looking at if there's a cavity that's present or not. Now, there's three types of structural joints that we're going to be looking at. These three are fibrous, cartilaginous, and synovial joints. Now, the second classification is the functional classification, and we're talking about how much movement the joint allows. So the three type of joints that we're going to be looking at are synarthrotic joints, where there's literally no movement at all. Then there's an amphiarthrotic joint that allows a slight degree of motion between the two bones. And then there's a diarthrotic joint. Now these diarthroses, these are the most freely movable joints. They provide a very wide uh, degree of motion to occur. Now, as far as these most freely movable joints, you're going to find these mostly at your limbs. So just about all your limbs. So another way to look at it, with the exception of everything that you have in your midline. So we're talking about everything that's part of your appendicular skeleton. You're going to find diarthrotic joints here. The majority of the joints here, they're going to be all diarthrotic joints. Now we're going to be moving forward. So the first thing that we're going to be looking at are the structural classifications that we talked about. So now the very first type of structural joint that we mentioned was the fibrous joint. Now bones in a fibrous joint, they're connected by dense fibrous connective tissue. They lack a joint cavity, and the majority of these they're completely you're not going to find any motion at all. Okay, so if there is, there's going to be a tiny amount of, well, more or less, it's like it's not even motion, but it's more of a give that's present. And usually, the amount of movement that's allowed, it's determined by more specifically the length of the connective tissue fibers that are bringing those two bones together. Now, the three types of fibrous joints that are present are sutures, syndesmoses, and the gomphoses. Now, the only place we're going to find sutures are between the bones of your skull. The wavy articulating bone edges of the skulls, they interlock with one another. Now, and the junction that we have, it gets completely filled by the minimal amount of these very short connective tissue fibers that run continuous with the periosteum. Now, what ends up in return, what ends up happening is you have a very rigid splices that end up knitting the bones together. But at the same time, it does give the skull the ability to expand during the youth. Now, after youth, during the Middle Ages, that those fibrous tissue they ossify, and now you end up having the skull bones that completely fuse together into a single unit. Now, at this stage, when the sutures are closed and they're ossified, now we call them the term that we use to describe them are synostoses. Now, in this picture here, you can see the bones of the skulls, the flat bones over here, and then so when you see these little wavy parts of the bones, these are both of these. They end up kind of like, think about it, it's kind of like a jigsaw puzzle. So when they come, these pieces they come together, they end up locking within themselves. Now, in addition to that, what's going to further secure these plates is the connective tissue that you find between the ridges of these bones. So now keep in mind, it's not a movable joint, but during youth, even though it doesn't move, it provides the ability for it to expand as a child's brain is growing and into young adulthood. As the brain grows, the skull is also growing. It allows for this to occur. But again, later on in life, during your middle ages, this is going to be gone. Okay, this fibrous connective tissue is going to be completely ossified, and this is when you end have this is when you end up calling this the synostoses. Okay, now this entire skull is going to be a single unit at that point. Now we're going to be looking at the next type of structural joint, syndesmoses. Now in syndesmoses, bones are connected exclusively by ligaments, bands, or cords of fibrous connective tissue. Now, the amount of movement allowed depends on the length of the connecting fibers. Now, regardless of the length, you're only going to get a slight amount of motion in this type of joint. For example, when you look at the ligaments connecting the distal ends of the tibia and fibula, uh, the tissue that's connecting it, it's quite short. Now, so what you end up getting is a very slight movement that occurs over here. It's not even more movement, but it's better described as a give that's present. Functionally, this type of joint we would classify as synarthrotic. Now, on the other hand, the fibers of the ligaments that are connecting the radius and ulna, which is the intraosseous membrane, it allows for the radius to cross over the ulna when you're pronating and supinating your arm. And this happens because the fibers are long enough. So, therefore, we would classify this functionally as a diarthrotic joint. So when you look at this, the distal tibiofibular joint, this ligament right here, this is the anterior inferior tibiofibular ligament. So, and this would be an example of this syndesmosis. So you're not getting any motion over here. More or less, what you're getting is the type of movement you're getting is you're getting a little bit of give between these two bones. So moving forward, we're going to be looking at Gomphoses. Now, in Gomphoses, what we have is a peg and a socket fibrous joint, and the only place that we have this type of joint is in the articulation of your teeth with the alveolar socket. And now remember, where do you find this? You find this. What two bones do you find them in? In the mandible and your maxilla. The maxilla, remember, is the upper port. It's the bone that holds your upper teeth in place, and the mandible is going to be the main bone that holds your lower teeth in place. So the fibrous connection in Gomphoses are the periodontal ligaments, which hold the teeth in the socket. So when you look over here, here's your tooth right over here. And now this is a mandible. So this is your lower jaw that we're looking at. And this is the alveolar process. And so what's holding these two bones are these periodontal ligaments. Okay. Now, in cartilaginous joints, the bones are united by cartilage, and as we saw in fibrous joints, they also lack a joint cavity. In addition to that, they're not highly movable as well. Now, the two types of cartilaginous joints that we're going to be looking at are synchondroses and symphysis. Now, a bar or a plate of hyaline cartilage will unite the bones at a synchondrosis. Now, just about all joints that are synchondroses are synarthrotic, which means they're not movable. So examples of this would be the temporary joints that we find at the epiphyseal plates in the long bones of children. Eventually, they become synostoses after the plate closes. And additionally, between the manubrium and your first rib, we also find a synchondrosis there. Now in this picture, you can see the epiphyseal plate over here. So this would be an example of synchondrosis. And again, this is the long bone in children. And remember, these two bones, the epiphysis and the diaphysis, they're united by synchondrosis. So and this is a synchondrotic joint, meaning this is not movable. And then the other place that we see it, as I discussed earlier, this is the manubrium, and this is your first clavicle. So again, this is another example of a synchondrotic joint. This is not movable. It's an immovable joint. Now, in a symphysis, the articular surface of the bones, they're lined with hyaline cartilage or articular cartilage. Now, this articular cartilage, it's fused with an intervening pad or a plate of fibrocartilage. Now, this fibrocartilage, this is the main connecting material. Now, symphysis, they're strong. However, they are slightly movable, so they're amphiarthrotic. Now, examples of where we find symphysis are the discs between your vertebrae, so the intervertebral joints. In addition to that, we also find it at the pubic symphysis. So when you look over here, again, right over here, this is a symphysis. This is between two backbones. So this is the it's a fibrocartilaginous intervertebral discs. So what we find over here, we're going to find hyaline cartilage that's going to be lining here, and then in between you have the fibrocartilage. And then again, where anteriorly, where your hip bone meets, this is the pubic symphysis. So this is the pubic region and the pubic symphysis. If you guys remember what this part of the bone was, anybody take a guess? Remember, this is the ilium, this is the ischium, and this bone is the pubis. All right. So when at the articular surface of the two pubis, the pubi, we have hyaline cartilage, and then you're going to have this fibrocartilage. This is the main connecting material. So again, in the symphysis, at this pubic symphysis, we have again this is the other place where you find this joint. Now, what we find at synovial joints are where the articulating bones, they're separated by a fluid-containing joint cavity. And this arrangement is what allows the bones to have an enormous degree of motion. Now, these are very freely movable joints, and so therefore they're classified as being diarthrotic. Now, just about all the joints that you find at your limbs are diarthrotic joints, or in other words, they are synovial joints. Um, Now, we're going to be looking at characteristics of synovial joints. As we move forward, one of the first things we're going to be talking about are the 6 general features that we find in synovial joints. Also associated with the synovial joints, we have bursa and tendon sheaths. In addition to that, we'll be discussing what stabilizes these synovial joints. Obviously, when you have a very large degree of motion, you need to have a special structure to help stabilize this joint. So we're going to be looking at the shapes of the articular surface of the bones, ligaments, and muscles. These are the primary things that help stabilize this joint. We're also going to be looking at the classification of the different types of joints. There's 6 to name. There's a hinge joint we find. There's a pivot joint. We find a ball and socket joint, a plane joint, saddle joint, and also a condylate joint. We're going to be looking at all these things as we move forward in the lecture. Now we're going to be talking about the 6 general features that we see at synovial joints. Now the very first thing that we see is this glassy smooth hyaline cartilage that covers the articulating bone surfaces as articular cartilage. Now the articular cartilage, although it's less than a millimeter in thickness, it acts as a spongy cushion that absorbs the compression that's placed on the joints, and this is what keeps the bone ends from being crushed. A feature that we find unique to synovial joints is the joint cavity. Now, this is just a potential space that contains a small amount of synovial fluid. Now, the joint cavity is enclosed by a double-layered articular capsule, or what we call a joint capsule. The external layer is a tough fibrous capsule that's made up of dense, irregular connective tissue that's continuous with the periostea of the articular bones. And what it does is it helps straighten the joint so the bones, they're not pulled apart. Now, the inner layer of the joint capsule is a synovial membrane that's made up of loose connective tissue. Now, aside from lining the fibrous capsules internally, it also covers all the internal joint surfaces that aren't covered by hyaline cartilage. Now, a small amount of synovial fluid occupies all the free space within a joint capsule. Now, the fluid is derived largely by filtration from blood that's flowing through the capillaries in the synovial membrane. Now, synovial fluid is quite viscous, meaning it's thick. In fact, its consistency is almost like egg whites. Now, this is because of the hyaluronic acid that's secreted by the synovial membranes. This fluid, it does become less viscous as the joint starts to warm up. Now, synovial fluid, it also lubricates and nourishes the articular cartilage. In addition to that, it also contains phagocytic cells that remove microbes and debris. Now, what synovial fluid does is that it provides a slippery weight-bearing film that reduces friction between the cartilages. Now, if you didn't have this lubrication, what's going to end up happening is the ends, they're going to start rubbing against one another. And then eventually you end up like eroding or burning away the cartilage that's there. If this continues on, the next thing that's going to happen is you're going to have bone-on-bone friction. In other words, now the bones are going to they're going to start rubbing each other away. And this is the worst thing that can happen. eventually you're not going to be able to move that joint. Now, the synovial fluid, it gets forced from the cartilage when the joint is compressed, and then when the pressure is relieved, the fluid is going to end up seeping back into the articular cartilage. This is kind of like how a sponge works also. This process is called this weeping lubrication. Synovial joints are reinforced and straightened by a number of type of ligaments. Majority of the time, they're capsular or intrinsic ligaments, which are thickened parts of the fibrous capsule. Other times, they remain distinct and they're found outside the capsule as extracapsular ligaments. Other times, they're found deep to it, and which is called intracapsular ligaments. Synovial joints, they have a very rich supply of nerves and blood vessels. Now, the nerves, they're mostly there to monitor the joint position and stretch. This is what helps this is what helps maintain the muscle tone. And the rich blood supply that the synovial joint gets, it is what helps form the filtrate that we find for the synovial fluid. So in this illustration, we see a synovial joint. So here are the two articulating bones, and you can see that the articulating bones, they're lined with this articular cartilage at the articulating surface. Now, we see this fibrous layer here, that the outer fibrous layer, and then we have this inner synovial membrane that forms the articular capsule. Uh, the space that's between within this capsule, it constitutes the joint cavity, and as within this joint cavity we will find the synovial fluid. We also see this outer ligament over here. Now this would be an example of this capsular ligament, and this is it thickens the fibrous layer to reinforce and straighten this joint. Now, aside from the 6 basic components that we talked about, certain synovial joints, they have other structural features. For example, in your hip and knee joints, they have these cushioning fatty pads that we find between the fibrous capsule and the synovial membrane or bone. Now, other places, they have discs or wedges of fibrocartilage that separate the articular surfaces. Now, where you have these, you call them articular discs or menisci. Now, these articular discs or menisci, they extend inward from the articular capsule, and they either partially or completely divide the synovial cavity in two. Now, bursa and tendon sheaths, they're not strictly part of the synovial joints, but they're found closely associated with them. Essentially, what they are bags of lubricants that acts as ball bearings that reduces friction between the adjacent structures during joint activity. Now, bursa, they're flattened fibrous sacs that are lined with synovial membranes, and they contain a thin film of synovial fluid. Now, we find these where ligaments, muscles, skins, tendons, or bones, they rub together. Now, a tendon sheath essentially is just an elongated bursa that wraps completely around a tendon that's subjected to friction. So it kind of looks like a bun that's around a hot dog. Now, they're common where several tendons are crowded together within the narrow canals. So, for example, in the wrist region is a great example. So, in this illustration, it shows you a frontal section of your right shoulder joint. So, we have your articulating bones over here, and so notice what we have is this fibrous, the outer fibrous layer of the articular capsule. You have the articular cartilage over here. You have your synovial joint over here. And of course, you have the inner synovial membrane that's lining this capsule. What else can we see over here? And then you see the tendon of the long head of your biceps brachii muscle. Now, the area of interest is the bursa. So we're going to be looking at this subacromial bursa over here. And notice that we have this bursa between this the ligament and bone over here and this bone over here, or this joint. So if you look over here, this is a close-up now. So we find this bursa where we have this ligament that's overlining this bone, and what it's doing is preventing these two surfaces from rubbing together. So this will roll around. It absorbs it. Remember, it's loose. It's cushioning. So this is what a bursa will do. So notice it's a flattened this disc. Now, sometimes when you have injury, now keep in mind they are lined with synovial membrane. What that means is they have a rich blood supply. So if there is an injury, some type of trauma, oftentimes what happens is that it'll fill up with fluid, and when it starts to fill up with fluid, what's going to happen is it starts to enlarge, and when it enlarges, now you have you decrease range of motion, and of course pain that's associated with it. So what has to happen is you have to go to your doctor or emergency room, and they need to aspirate that fluid out of this sac. And once they remove that fluid, again, that's going to be blood, then you're going to end up relieving that pain and also restoring motion back to this joint. Now, because joints are constantly stretched and compressed, we have to worry about dislocating them. So they need to be stabilized. Now, we earlier on we talked about the three things that stabilize the joint. So let's talk a little bit more about it in detail now. Now, the first thing is the shape of the articular surface. Now, this plays a role, but not a major role in stability. So generally speaking, the more shallow the surface is, the less stable it is, and the greater the surface that we have, or in other words, uh, whenever we have larger articular surfaces that are fit snugly together, or when you have deep sockets, as we do in the example of a ball and socket joint, these are the best and most stable type of joints. Now, the other thing are ligaments and their number and their location. This also plays a limited role. However, with that said, the more ligaments that you're going to have, the stronger the joint is going to be. Now, the most important of three things is muscle tone. So muscle tone, this is essentially what it is the when muscles are relaxed, this is the amount of contractility it still has. In other words, when a muscle is relaxed, the tendons, it's still under a certain degree of contraction. And when this tone, it is what pulls on the muscle tendon that's attached to the joint, and it is what helps keeps the bones in place. This is extremely important in reinforcing your shoulder and your knee joints, as well as the arch of your foot. Now, let's look at in these illustrations over here. You have this, I'm sorry, not illustration. There is an illustration, but you also have this chart over here. So it's going to be talking about the type of joints that we have here over here. So when you look at your skull, the articulating bones are your cranial and your facial bones. And the structural type is this fibrous sutures that we have. And these are synarthrotic joints, meaning there's no movement that's allowed. Now, when you look at your temporomandibular joint, so the bones obviously will be the mandible, which is your jawbone, and the bones of your skull. Now, this is a synovial joint. It's a modified hinge joint, okay, which has this articulating discs there. It's diarthrotic. It provides gliding and uniaxial rotation. It has slight lateral movement, elevation and depression, protraction and retraction as well. Now, we're going to be talking about all these movements, but before we get to there, let me just mention that there are 6 types of synovial joints. These are hinge joints, pivot joints, ball and socket joints, plane joints, saddle joints, and condyloid joints. We'll be talking about these in the second part of this the lecture for chapter 8. But let's move forward. You have this atlanto-occipital joint, and as the name applies, it's the occipital bones of the skull and the atlas, the very first bone of your cervical spine. And this is also a synovial condylar joint. It's diarthrotic. It's biaxial flexion, extension, lateral flexion, circumduction of the head and on your neck. So again, you have a very wide degree of motion over here. The next one is this atlantoaxial joint, and this is where you have, again, as the name implies, your atlas and axis, C1 and C2 articulating, and it's a synovial pivot joint. It is diarthrotic. However, this one is uniaxial, and what it does is it just allows the rotation of your head. So remember, this is lets you rotate your head from side to side, as in when you're nodding no. Whereas the first one was, you're nodding yes in addition to, you can rotate your head around, flex it, extend it. Now you have your intravertebral discs. So again, the bones that are involved are the bones, the vertebrae that are adjacent to the ventral bodies. It's a cartilaginous symphysis. It's amphiarthrotic, meaning that it has slight degree of motion. Now, also between the articular processes of the intervertebral discs, there's also a synovial or plane joint, which are diarthrotic gliding along the costal the costal vertebral. So in other words, we're talking about the bones of your ribs and the vertebrae where they come together, the transverse process or bodies. You have a synovial plane. This is also a diarthrotic joint, where in other words you have slight gliding of the ribs taking place here. Let's look at now in the front part. So over here we have your anterior uh, thorax. You have your sternoclavicular joint. So again, as the name implies, you have your sternum and clavicle that are articulating. And this is a synovial joint. It's shallow saddle joint. This also contains an articulating disc. It's diarthrotic. It's multi-axial. It allows the clavicle to move in all the axes. Now, the sternocostal, okay, the first sternum and rib one, it's a cartilaginous synchondrotic joint. There's no movement, so we say that it's synarthrotic. Now, the remaining sternocostal joints, ribs 2 through 12, again, these are synovial, they're double planed, they're diathartic gliding joint. So when we look at your limbs, now your upper limb, you have your acromioclavicular, your acromioclavicular joint, and the articulating bones here are the acromion of your scapula and clavicle, and structurally this is also a synovial joint. It's a plane joint, it's diarthrotic, it has gliding and rotation of your scapula on your clavicle. When you look at the glenohumeral joint, okay, we're talking about your shoulder over here. It's the bones that are articulating are the scapula and the humerus, okay, specifically the head of the humerus, and it's a synovial joint. It's a ball and socket type of joint, the type of synovial joint. Now it's diarthrotic, multi-axial. So again, diarthrotic, you have a lot of motion over here. You have flexion, extension, abduction, adduction, circumduction, rotation of your humerus. And don't worry about this. We're going to be talking about what all these motions are in the coming slides. Elbow now. Your elbow joint, again, the bones are, as you guys know already, your radius and ulna, along with your humerus. So this is a hinge joint. It's a type of synovial joint. It's diarthrotic, uniaxial. You have flexion and extension of your forearm here. The proximal radial ulnar, you have the bones that are articulating are the radius and the ulna. It's a synovial joint also, a pivot joint, diarthrotic, uniaxial motion. You get pivoting the convex head of the radius. It rotates with the radial notch of the ulna. At the distal radial ulnar joint, you have your radius and ulna again, and it's a synovial joint. It's a pivot, and it also contains an articular disc. It's diarthrotic, uniaxial type of joint. So again, you have a lot of wide degree of motion, rotation of the radius along around the long axis of your forearm, and this is what allows you to turn your arm up and down, upwards and down. So if you take your palms and you put your palms towards the ceiling and downwards again, this is the motion that it allows. Okay, which is called pronation and supination. The wrist joints, again, you have your radius and your proximal carpals. Scaphoid, lunate, triquetrum, and pisiform. Now, it's a synovial joint, condylar. It's diarthrotic, biaxial, allows for flexion, extension, abduction, adduction, and circumduction of the hand. Now, the intercarpal, these are the adjacent carpals. It's synovial plane. It's just a diarthrotic gliding joint. Now, gliding motion. Now, the carpal metacarpal of the first digit, your thumb, it's the bones that are involved are the trapezium. Okay, this is with the first metacarpal bone. Remember, trapezium. This is one of the carpals. Okay. And you have a saddle joint here. It's a synovial joint. Type of synovial joint is a saddle. It's diarthrotic, biaxial. It also flexion, extension, abduction, adduction, circumduction, and opposition of metacarpal 1. So think about all the motions that you have in your thumb. What could you do? You can flex it, you can extend it, you can move it towards your pinky finger, you can move it away from the pinky finger, you can rotate it, okay? You can, in others, you can twirl your thumb in a circle, and also you can touch all your other fingers. These are all what these motions are. Again, like I said, we'll be looking at these motions in the next few slides, so don't worry about it. If it's not in this lecture, it's going to be in the next lecture in part B. We have your carpal metacarpals of distal digits 2 to 5. And again, you have your carpals and metacarpals over here. And it's a synovial planar joint, diarthrotic, and you have gliding of the metacarpals here. Now, the metacarpal phalangeal joints are your knuckles. These are the metacarpals and the proximal phalanx. And its synovial joint is condylar, diarthrotic, biaxial joint. So you have flexion, extension, abduction, adduction, and circumduction of the fingers. Now, the interphalangeal joints, your finger, these are the adjacent phalanges. Is a synovial hinge joint. It's diarthrotic, but it's uniaxial. So it just allows for flexion and extension of your fingers. Now let's look to your lower limbs. So this is the first thing we're going to be talking about is your sacroiliac joint. So the bones that are involved here are the sacrum and the coxal bones. Now this is a synovial joint as well, and it's again plain in childhood, and increasingly it turns fibrous in adults. Remember, the bones fuse. So it's diarthrotic in child and amphiarthrotic in adults. Now the pubic symphysis, the pubic bone, it's a cartilaginous symphysis. It's amphiarthrotic. Now it allows slight movement. So again, during pregnancy, when you're delivering, this is what kind of helps allow the pubic bone to separate a little or stretch out a little bit during the delivery of the child. You have your coxal bone over here, okay, your hip joint, and what you have is the hip bone, and remember specifically you're talking about your acetabulum and the head of the femur. So this is a synovial joint. It's a ball and socket joint. Is diarthrotic, multiaxial, flexion, extension, abduction, adduction, rotation, circumduction of your thighs. Now your knee joint, okay, or tibial femoral joint. As the name implies, the bones that are articulating are your femur and tibia. It's synovial, it's a modified hinge joint, and it also contains articular discs. It's diarthrotic, biaxial, so this allows for flexion and extension of your leg. It does allow some degree of rotation. That's allowed in the flex position. Now, also you have your femoropatellar joint as a knee. The name implies it's your femur and patella. In other words, your knee. Synovial plane joint is diarthrotic, and it allows the patella to glide. You have your superior tibiofibular joint, and the bones is the tibia and the fibula. Again, proximally. So it's right over here, where the tibia and the fibula they articulate proximally to the body. And then you have another one that is going to articulate distally. So over here, it's a synovial joint, it's a plane joint, it's diarthrotic, and it allows the fibula to glide. Your inferior tibiofibular joint, the tibia and fibula, again, where they articulate distally, it's fibrous, syndesmoses. It's synarthrotic. Remember, what do you have? No motion. It just gives a slight amount of give during dorsiflexion. Your ankle joint, you have your tibia and fibula with your talus, and that's the first. That's the bone that's articulating with your tibia. It's synovial joint. It's a plane joint, diarthrotic, and it allows gliding of the metatarsals. Then you have your metatarsophalangeal joints. Yes, and then what do we have here? Your metatarsals and the proximal phalanx. It's a synovial joint. It's condylar. It's diarthrotic joint, which allows biaxial motion. You get flexion, extension, abduction, adduction, circumduction of your toe or your hallux. Now, in the interphalangeal joints we have here are the adjacent phalanges. And what we have here is a synovial hinge joint. It's diarthrotic. You have uniaxial motion here, flexion and extension of your toes. All muscles, they attach to bones or connective tissue at no less than 2 points. Now, the origin, this is the attachment to the bone that's not moving, okay, to the immovable bone. The bone that's going to be moving is referred to as the insertion point. So muscles, they contract. When they contract, they cause the insertion to move towards the origin. And movement occurs along the transverse, frontal, or sagittal planes. Now, the range of motion that's allowed by synovial joints, they could be non-axial, meaning that you only have a slipping movement. They could be uniaxial, meaning you have movement in one plane. They could be biaxial, meaning you have movement in 2 planes. When you have movement in all 3 planes or all around, then you call that multi-axial. The general types of movements that we have are gliding, angular movements, and rotation. Now, gliding movement is when we have one flat bone surface that glides or slips over another similar surface. So, for example, in your intercarpal joints, intertarsal joints, and also between the articular process of the vertebrae are examples of gliding movement. So you look over here as your the move this palm is going from side to side. These carpal bones, they're gliding. So this is where you have this gliding movement. The angular movement, as the name implies, it affects the angle between the two bones. It's either increasing or decreasing that angle. So movement is along a sagittal plane. Angular movement, they include flexion and extension as well as hyperextension. Now, flexion, it decreases the angle of the joint, whereas extension increases the angle of the joint. And hyperextension, it provides movement beyond the anatomical position. So when you look over here, when you're taking your chin and you're trying to touch your chest, that's a flexion. When you uh, move your chin away from your chest back straight upwards into the anatomical position, then that would be extension. Then when you're taking the back of your head and you're trying to touch your shoulder, your shoulder, for example, you're hyperextending. Okay, that's hyperextension. So again, another example, when you're bending forward, when you're bowing, that's flexion. When you stand back up straight, that would be extending. And then when you're stretching your back towards all the way to the back, as in when you're trying to crack your back, that would be hyperextending or hyperextension. You can see over here also, look at the knees when she's making this angle smaller, that's flexing. When she straightens it back out, that's extension. So you have flexion, extension of your this joint over here of your lower limb. Obviously, you cannot hyperextend. Same thing with the arm. Notice she's flexing it over here, and then she's extending it. Same thing if you take her arm and she'd bring it upwards the way on if you would in other words, if you want to see the bicep move, when the bicep contracts, it will pull this arm upwards, your forearm upwards. That would be flexion. And then when the biceps relaxes, this muscle up over here, then that would be extension. Abduction, adduction. Now, when you look at this term, ab, that means away. So when you have movement along the frontal plane that's away from the midline of the body, it's abduction. And then adduction, you have movement so you have movement along the frontal plane towards the midline of the body. So when you move you're standing in the anatomical position and you move your arms away from the body, that would be abducting. Then when moving back towards the midline of the body, that would be adduction. Now, circumduction, this involves flexion, abduction, extension, and adduction of, I'm sorry, let me say that again. Circumduction involves flexion, abduction, extension, and adduction of your limbs. So when we look at the next picture over here, this is circumduction. So when you're rotating your arms, okay, you're making circles with it, that's circumduction. Okay, abduction, notice what you're doing. You're taking your arms, you're moving away from the midline of your body, abducting. Then adduction is when you're moving your arms back towards the midline of the body. Now, rotation, this happens when you're turning the bones are on its long axis towards the midline or away from it. And we have medial rotation, that's towards the midline, and then you have lateral rotation away from the midline. So examples of this is rotation between your C1 and C2 vertebrae. It's a very good example. And also of the rotation of the humerus. So if you have your arms, you're standing up, you have your arms hanging towards the sides, and then you rotate your humerus so like your elbows are pointing towards the sides. In other words, when your elbows are pointing laterally, that would be an example of rotation, okay, of your humerus, for example. And you can do the same thing with your femur. Um, so when you look over here again, also, when you're turning C1, C2, you have rotation over here, as in when you're doing a no. And then again, if you look over here, you cannot see very clearly in this picture, but you have um, lateral rotation of the leg. So notice she has it pointed outwards, and then medial rotation when she turn it back inwards. Now, special movements that we have at synovial joints are supination and pronation. So this is the rotation of radius and the ulna. So when you have your palms facing towards the ceiling, that's called supination. Then when you're taking your palms and you're facing it downwards, that's pronation. Okay, dorsiflexion and plantar flexion of the foot. When you're driving a car and you're stomping on the gas, that's an example of plantar flexion. Now, when you lift your foot off the gas, that's an example of dorsiflexion. So here's your palm. We have it facing upwards. That's called supination. When you rotate it and your palm's facing downwards, that's pronation. Same thing with your foot. When you're stomping on the gas, okay, you want to speed off at a green light, that's plantar flexing. And then when you want to take your foot off the gas pedal, that would be dorsiflexion. Inversion and eversion of the foot, again, you're taking the sole of your feet and you're facing it medially, that's inversion. And when you face it laterally, that would be eversion. Then there's protraction and retraction. So you have movements in lateral planes. So protraction, when the mandible juts out, and retraction was when your mandible is pulled back towards the neck. So over here you can see, the sole of your foot facing medially, it's inversion. Then when you're doing it facing it laterally, that's eversion. So again, you have your mandible here, and when she's projecting it forward, that's protraction. And then when she brings it back inward towards her neck, that's retraction. Okay, protraction, retraction of the mandible. You also see this in pigeons. When pigeons walk, you'll see their necks move back and forth, back and forth. That's protraction and retraction in pigeons. Now, elevation and depression, these are also movements that we see at synovial joints. So, for example, when your elevation is lifting the body parts superiorly. So when you're shrugging your shoulders upwards, that's elevation. Then when you're shrugging, you relax your shoulders back down, that would be depression. So lowering the body part. So when you're opening your jaw, that's an example of depression. When you're closing it back up, that's an example of elevation as well. Opposition, you see, well, it allows movements of your thumbs. So when you take your thumb and you touch the tips of your other fingers, your second, third, fourth, and fifth digits, that's an example of opposition. So here you see the mandible is open. Okay, so she's opened her mouth. Her mandible is moved downwards. That's an example of depression. When she closes her mouth and moves it back up, that's an example of elevation. So again, if she shrugs her shoulder upwards, brings her shoulder closer to her ears, that's elevating. Then when she brings it back downwards, that would be depression of the shoulders. And then you can see opposition over here. You're taking your thumb, you're touching your middle finger, your index finger and thumb, middle finger and thumb, ring finger and thumb, pinky finger and thumb. These are all examples of opposition. Now, there are 6 different types of synovial joints, and they're categorized based on the shape of the articular surface as well as the movement the joint is capable of. Now, in plane joints, the articular surfaces, they're essentially flat, and they allow only a short non-axial gliding movement to occur. So examples of gliding joints we looked at a little bit earlier are at the intercarpal and interstitial joints. In hinge joints, the cylindrical end of one bone, it conforms to a trough-shaped surface on another. Now, motion is along a single plane and it resembles that of a mechanical hinge. Now, uniaxial hinge joints, they allow only for flexion and for extension to occur. Now, in a pivotal joint, what we see here is that the rounded end of one bone, it conforms to a sleeve or ring composed of either a bone or possibly a ligament of another. The only movement that is allowed is uniaxial rotation of one bone around its long axis. In condylar joints, also known as ellipsoidal joints, the oval articulating surface of one bone, it fits into complementary depression in another. Now, the important characteristic is that both articulating surfaces, they're oval. Now, the biaxial condylar joints, it permits all angular motions to occur, meaning you get flexion and extension, abduction and adduction, as well as circumduction. Now, in saddle joints, they resemble condylar joints, but they allow greater freedom of movement. Now, each articular surface, it has both concave and convex areas. In other words, it looks like a saddle. Now, the articular surfaces, they fit together concave to convex. Now, in a ball and socket joints, the spherical or hemispherical head of one bone, it articulates with the cup-like socket of another. Now, these joints are multi-axial and the most freely movable joint, synovial joint that we have in our body. So it allows for universal movement. Perfect examples is we see it at our shoulder joints or our hip joints as well. So in this illustration, what you can see is a plane joint, and we're looking at your intercarpal joint. You can also find these as intertarsal joints as well as between the vertebral articular surfaces. So notice the movement that we only have over here is a gliding movement, and the articulating surfaces, they're flat. This is your hinge joint over here. Perfect example is the elbow joint or the interpharyngeal joints. So notice what we have here. This is your cylindrical shaped bone up over here, and then you have this trough shaped bone down over here. So this is where you're going to get this bone fitting over here with this bone. So here you go. You can see it. The ulna is the example of the toe over here, and then the humerus bone. It's going to be the example of the cylinder shape structure of the second bone. And what this type of motion allows for is for flexion and for extension to take place. So again, we state that this is uniaxial movement. So in this illustration here is an example of a pivot joint. Now, what you're looking at over here is the proximal surface between the radius and the ulna. Also, you find this at the atlantoaxial joint. So what you see over here is in one bone, or one side, you have a sleeve that forms, and that could be either bone and a ligament. In this case, you have a ligament, and then you have the rounded bone that's fitted within it. And what this will allow for is uniaxial movement of only for rotation to occur. Now, this is an example of a condylar joint over here, and what we see over here are that both articulating bones, they are oval in their surfaces. So you have in this picture, this is an example of the metacarpal phalangeal joint or the knuckle joint, and what we see here is that we end up getting this biaxial movement. So the movement. One movement allows for flexion and extension to take place, and that's going to be along the medial lateral axis. And along the anterior posterior axis, we get abduction and adduction taking place in this condylar joint. Now, as I said, the saddle joint, it resembles the condylar joint, but remember, in the condylar joint, the shapes were both oval, and that was a key distinguishing characteristic. In the saddle joint, one area is concave and the other is convex, but it's not oval in its shape. So this example occurs at the carpal metacarpal joint of the thumbs, and also the motions that you get over here, they're biaxial movement. So again, for anterior posterior axis, you're going to get adduction and abduction, and then for the medial lateral axis, you're going to get flexion and extension to take place. Finally, we have the ball and socket joint. Now, this is an example of your shoulder joint. You can also find this at the hip joint. So here you have the head of the humerus over here, and then it's going to be articulating at the glenoid cavity of your scapula. So what we have over here is, again, you have a cup-shaped socket, and then you have the spherical head or the ball of the articulating bone. So the movements that you get over here, they are, you get a medial lateral axis, you get flexion and extension that takes place. Along the anterior posterior axis, you'll get adduction and abduction that takes place. And then along the vertical axis, you end up getting a rotation that takes place. So again, this type of joint provides the most movement out of any other type of synovial joint. And that's it for the first part for Chapter 8. If you have any questions, please feel free to email me at my Gmail address. You can find that in the comments below. In addition to that, feel free to leave comments in the section below, as well as send me a message through YouTube. If you like the videos, please be sure to give it a thumbs up. Also share it with your friends, and please be sure to subscribe. When you subscribe, when I have new videos that go up, you guys will be the first ones to get notifications, and you won't have to look around for it. Thank you again, and have a wonderful day, and best of luck on your exams and your course.